So that's a very good thing to do. All right, let's go to the next one. Does that make sense? That longus colli?
Mm-hmm.
Good. Are you still having some interest, or are you starting to fall asleep?
Nope.
Excellent.
Good.
Excellent. So now we're going to the back. We're going to go deep to the back. The muscle that I want to talk about, or a group of muscles, those are the suboccipital triangles. Those muscles are right underneath your occiput. Now you need to reach beyond, deeper than the trapezius. So they are below, deeper, very, very deep to the trapezius. Actually, there's even a middle layer that we're going to talk about next. But those suboccipital triangle muscles have 4 parts to it. There's actually 4 different muscles. We have a rectus capitis, major and minor, and those lie right here, deep, deep. See, this is the trapezius here, cut, and then this is the next layer down. It's called the semispinalis. We're going to get to that. Also, there's this one on the outside. It's very interesting muscles too. But then deeper than that, right, very deep, are this one and this one on each side. And this is the rectus capitis minor, and this is the rectus capitis major. So this one goes, the major goes from the C2 down in here, transverse process, and reaches up to the occiput. And that's the major. Then the minor reaches from the C1 back, transverse process, spinous process, and reaches up to the occiput medially. Mm-hmm. Okay? Mm-hmm. And when we look at them, and what they do is when they contract, they will extend the head. But they also, when they do contract on one side only, they rotate the head to the same side. So they rotate, and they contract here, they rotate the head this way. Mm-hmm. Does that make sense?
Yeah.
Okay, they come together here. These muscles are also very interesting because they're connected to our eyes. Mm-hmm. So when you're very, very relaxed, and you touch them, and you move your eyes on the inside back and forth, side to side, they actually contract. Mm. And this muscle is a key muscle to the whole back of the person or of an animal, and the whole back musculature will react to what this muscle is doing. Mm-hmm. And that's why when you throw a cat into the air, it will orient itself because it orients the head, and once the head orients itself, the whole back will orient itself. Okay. So it doesn't fall on its side. And so that's because of these. So that's very, very interesting. The other one too that come to the set are the obliquus capitis. We have one that's superior and we have one that's inferior. So the superior ones goes from the transverse process of C1, which is right here, the outside piece. You can actually feel that on yourself. It's kind of like, a little bit anterior to the mastoid process behind the earlobe. And then that one reaches to the occiput up here. Mm-hmm. Okay. So that's the superior. The inferior is different. So let's do the action of the superior. So when they contract together, they will extend the head. They also tilt the head to the same side, but they rotate the head to the opposite side. So to see that, we have to look here. See that muscle here, the green one? Mm-hmm. That's that muscle. So when that, see, that looks different, right? So when that contracts here, it will move the head over there. Okay? Mm-hmm. So it contracts it moves the nose to the other side. The inferior is a different muscle. It's not like these up here, they're different. So the inferior starts at the SP of C2 and reaches into that TP of C1. And when that contracts bilaterally on both sides, it will extend the head. But this one rotates the head. When that contracts here, it rotates the head to the same side. Mm. The nose comes to the same side. Does that make sense?
Yes.
Good. Down in here, you have a few patterns of pain that are associated with these muscles. Just for FYI. Again, if somebody has a headache, you want to massage, try to get into these muscles anyway. Yeah. So you can lay the patient on the back and just sort of cradle their head and slowly work your fingers into that muscle deep right in the base of the occiput. All right. And now that brings us to the level in between that deep level and then the trapezius on the outside and the back of the head. So we have the semispinalis and the splenius muscle. I like these pictures. So we have the semispinalis, that's right here. So that's really, really medial. And we have the splenius that's a little further out. They both come with a capitis and a cervicis. And the capitis is the one that attaches to the head, and the cervicis is the one that attaches to the spine. And so the semispinalis capitis goes from the transverse processes of C4 to T7. That's deep down. T4 to T7. And I checked that. Even though these pictures don't look like it, I double-checked the book. And then it reaches out. You can see how it reaches into that occiput right in here in the back of the head. So that's superior to the rectus capitis major and minor. And sandwiched in between then the trapezius, which is more superficial. Then the cervicis goes from the TP of T1 to T6. Again, it doesn't look quite like it's reaching down there, but that picture is just very well visualizing it otherwise. And then it goes up to the spinous process of T2 to C5. And when they contract, they extend the head and the neck, depending on which one is contracting. And they tilt the head or the neck to the same side this way. But the way they're arranged, since they go to the TPs and the SPs here, they rotate the head to the opposite side. Does that make sense?
Yes.
The nose will look to the other side. All right? Here are some trigger point patterns. Again, that's a different class. We'll do that next time, Mr. Massard. I think that'll be interesting. And then that brings us to the splenius. The splenius is on the same level of depth. It's just lateral on the side, more outside on the towards the ear, and the mastoid process than the semispinalis. So again, we have a capitis and the cervicis. The capitis goes from the nuchal ligament here, the spinous C3 to T3, reaching down, to the occipital bone, right up here. A little medial to the mastoid process. And then the cervicis goes from the spinous process of T3 to T6 and reaches up to the TP. And that's going to be important, of C1 to C2. So those are quite lateral. If you see here, the semispinalis goes more from medial to the TPs, which is lateral, right? Or from the spinous to the TP. And this one goes the other way, from the TP outward, from the SP to the TP. And so when we look at what the action is, when they contract both together, they bring the head back, so they extend the head and the neck. That should also say neck, head in here. But then they tilt and rotate the head and the neck to the same side if they contract on one side unilaterally. So if this one contracts, it will bring the head this way down, but it also brings the nose to the same side of the muscle that contracts. Does that make sense?
Yep.
All right. So those are small little minute differences, but when you look at the biomechanics and you digest the material a few times, they'll start make some sense. And then again, these are just the trigger points. When you print it out, there is at least some of those to look at. All right. That brings us to the erector spinae muscle, and we're moving right along. I know it's a long session. These are the back muscles. We have a few layers to the back muscles. We take two of them down that I want to work with. The erector spinae are sort of the superficial one, and then one deeper will become the multifidus muscle. So when you touch your back with your one hand above the crest right here, and you go up a little bit, and you extend, or actually what you do is you reach forward. If you reach forward, you start feeling them. They start contracting. They start bulging up a little bit when you bring your chest forward. You feel that?
Yeah.
Yeah, so that's actually interesting, because if you have back pain, that becomes very important. Because when these muscles contract, your spine compresses. It pulls the spine together. So those are these erector spinae muscles. So the iliocostalis is one of them, the longissimus is another one, and the spinalis is another one. They have three levels. So we have one out here, that's the iliocostalis. Then we have a long one here underneath, and then we have a very medial one, this bend, and that's the spinalis. Ilio means ilium, that's the hip. Cost means rib. So this muscle sort of starts in this area down here and reaches up towards the ribs. All right? Longissimus means long. In my world, that means long. Long means long. And that's the long one of the three. So that goes all the way from the pelvis or the transverse process and reaches up to other transverse processes. More or less.
Yeah.
And then the spinalis is the one right by the spine, so I remember it because it's right by the spine. So it goes from spinous process up to another spinous process. Make sense?
Yep.
More or less, we have it here. These are all the origins. And then the action, what's important, it is of course it helps with spinal extension. So if these contract, it pulls that spine back. But that also means when we go forward, it contracts so we don't fall down. Right? So it lets us not, when we bend forward, it lets us not fall down because of gravity. So that's where these muscles become important. When you go forward with your chest, you will start contracting them. If you want to take pressure off your back, you can bend back a little bit and feel them and see what happens when you reach your chest back and upward and the shoulders roll backwards, how they relax. Then the other thing you can do is you can tuck your chin in, and then you will even relax those muscles more. And so that becomes important and helpful when you have pain in there. They also laterally flex, so that's side bending. So that means you go to the side when one side contracts. And when they contract here, they bend the body, the trunk, to the same side. So that's ipsilateral rotation. And this is here, the control of forward bending. I was talking about that before. Here are some of the trigger point patterns. You'll touch them all and go back or up if you want to be versed in those techniques. And then we go deeper. And the deeper muscles now in the back become very important because they're going to help us stabilize. They